So disclaimer, any of the opinions or views expressed are not necessarily those of Kayla or myself. Or excuse me, they are specifically, yeah. Uh-oh, we're on a timer here.
How did we get on time?
I'm not sure how we got on a timer.
Okay. You better
You just
talk a
up
lot.
arrow.
Yeah, I'll just back it up.
You up arrow.
So we do not represent the DOJ. We're not representing George Mason University. Our views are strictly our own views. The only disclosure that we have is that Montana is a really extraordinary place to visit. If you haven't been to Montana before, it's really kind of a wonderful place to spend some time. The objectives are to define the Montana State Medical Examiner's Office and the role with the NIJ-NCF, illustrate the changes at the Montana State Medical Examiner's Office, explain the role of the Coroner Liaison, and illustrate potential cost-effective and death investigation benefits of a state medical examiner's office effectively coordinated, and that should actually be 56 Montana county coroners, at least technically, but there are 3 counties which are represented by 1 coroner. Dick Brown, I'm sure, is still.
Yes.
Yeah. So the National Association, the National Center for Forensics was established through a competitive grant that was funded by the National Institute of Justice, and it was to provide scientific and technical learning opportunities for medical legal community and targeting medical students and focused on underserved rural areas. Montana would certainly serve as a underserved area. In 2015, they lost all their medical examiners and had to send decedents to Seattle, King County Medical Examiner's Office, or Rapid City, South Dakota for postmortem examination. So it was a big hardship that they had to get through. And this is to provide forensic science and legal training information to support law enforcement, district judges, and other appropriate criminal justice agencies. It's to develop, consolidate, and provide access to resources and opportunities for education, training, and best practices in the forensic science community, structured to benefit current and future practitioners in the field. And so this educational opportunity over the last couple of days, I know for me over just yesterday and today, has been really a wonderful gathering that Joe and the NCF has put together. Overall goal, increasing pathology workforce through feasible practical interventions. And then the grant recipients for the 2020 grant was George Mason University, NAG, or National Association of Attorney Generals, Montana State Medical Examiner's Office, and the American Society for Clinical Pathology. So this is the 2020 recipients, which I just listed. And then in 2021, there was a second grant that was awarded, and that was to the University of Alabama and the Department of Forensic Sciences and the District Attorneys Association of Alabama. Is anybody here from that second group participant or group? Okay, no. I know that there was some desire to get collaboration. Okay, oops. Yep. All right. Has there been any collaboration with folks from Alabama? No. Oh, okay. Well, if we take a look at death investigation systems throughout the United States, we have the map that's on the right. We have 7 medical examiner systems that are not centralized. So a great example, I know there's some folks here from Michigan. Michigan has counties which are served by medical examiners, which might be family practitioner, pediatrician, neurologist, whatever. And then there are some municipalities within Michigan that have forensic pathologists who are board certified. And then other examples of decentralized medical examiner systems are illustrated in red. Now, if we take a look at the states that are in gray, those are centralized medical examiner systems. And the centralized medical examiner systems will operate either out of regional offices or in a single office. So Maryland is a good example, has a relatively small state geographically. You've got one office in Baltimore, and it serves the entire region. If you take a look at Utah, or if you take a look at New Mexico, there are large areas that are served by just one single central office. So challenges in terms of transportation back and forth. And then there are states which have a kind of a mixture of coroner and medical examiner systems. And then there are states which have just coroner systems. And they vary greatly in terms of how they all work. But that's sort of the lay of the land in terms of death investigation throughout the United States. And I would say that it's more consistently inconsistent than it is consistent. You have a question?
Yeah, I just wanted to mention Texas is listed as a county medical examiner system, but it's actually a combined system, just different than the other ones. There's only about 6 county medical examiners offices in the entire state of Texas, and the rest of the smaller, more rural counties are on the justice of the peace system. So it's typically a voted lawyer in a judge position who is signing the death certificates. And so many of them will actually, if they feel the need, send the bodies to a medical examiner office or a forensic pathologist for autopsies for opinion. But they can still choose whatever they want.
Right. So it's
Really more of a combined system, but it's JP and medical examiner.
Yeah, that's interesting. Challenges to coroner systems. If you take a look at challenges to coroner systems, it's been taking place for a long time. Part of that, if you go back to the inception, if you will, of the coroner system here in the United States, it was because we were tied to England. And in England, around 1100, you see the crowner system, and the crowner was basically authorized by the king to collect death taxes and also investigate death. And death, if there was a murder or a homicide, then that coroner could call an inquest, and that was basically on behalf of the king. So, fast forward to where we're at today. Death investigation utilized a coroner system in the United States up until the 1860s. And in the 1860s, the folks in Baltimore thought, well, physicians have a better understanding of disease and how it affects the body. And perhaps physicians might be better suited to determine cause and manner of death than a layperson. And so they mandated initially that the coroner be a physician, and then later is when the term medical examiner system was adopted. And that's when you saw physicians taking over the job of death investigation in some states. And then in other states, coroner systems were retained. And so, depending on where you live, it's transitioned significantly through the years. But nevertheless, this was an article that was in 2021, and this came from Scientific American, and it basically says, those who investigate premature deaths should have medical training. And it says that, that it's a problem that coroners don't have medical expertise. And I would advocate that actually coroners can do a fantastic job in terms of doing death investigation. And that happens in many, many coroner jurisdictions. And typically it's because of collaboration with the coroners and the medical examiners. And that's no different than the collaboration that takes place in a medical examiner's office with an investigator. So Kayla, as an example, had served as an investigator for the Boulder County Coroner's Office, which did not have a lead that was a forensic pathologist, but rather a very dedicated coroner who really wanted to do the right things. And then, of course, Kayla went on to the Denver County Medical Examiner's Office, Coroner's Office, which was headed by a forensic pathologist, and had extraordinary training and background. We were lucky to get her up in that camp. But at any rate, that's kind of the background. And if you take a look at it, coroner systems will not and they cannot be replaced anytime soon. And that's because medical examiner systems generally are present in the urban areas and or in state centralized systems. But the vast majority of death investigation systems are coroner systems throughout the United States. And there are many coroner medical examiner systems that perform exceptionally well. There are no systems that are perfect. So there are some medical examiner systems that have great opportunity to do things differently. If you haven't seen, there's really it's kind of a good thing, bad thing. Outside of the context of the conference here, if you Google John Oliver, everybody is John Oliver. Google Death Investigation by John Oliver. And if you haven't seen that, it's hilarious, but it's also sad at the same time. So it does a good job of highlighting some medical examiners' offices that had opportunities to do things differently. So coroner investigators and medical examiner investigators, they do the same thing. It's the willingness to adopt change that makes the difference. Pathologists, forensic pathologists can assist coroners' offices achieve optimal death investigation practices, and it requires education and collaboration. So if we take a look at what happened in Montana, the Forensic Science Division was established in 1997, and it was one of 8 divisions within the Department of Justice. So it's a little bit different from some of the systems that you all come from. Usually you don't see death investigation systems wrapped up in how should I say, a justice department per se. So it's usually separate from sheriff's offices or police departments, things of that sort. But the lab incorporates a DNA serology, toxicology, chemistry, chemical analysis, fire marks, tool marks, and we are an A and AB ISO accredited laboratory. The main office was in Missoula, and it was created as a forensic science division section in 1980 to serve the Montana coroners. So prior to that, any pathologist in the state could perform autopsies, and like so many other states, they started to make a transition to having board-certified forensic pathologists do forensic autopsies, which in my opinion was generally a good thing. By 2005, the Medical Examiner's Office in Missoula employed 2 forensic pathologists who served Western Montana, and there was 1 contract pathologist who served Eastern Montana. And so this is just a picture of the laboratory. That's Scott Larson, who is our administrator. He was one of the guys who was able to get us incorporated with the NCF, but just kind of a general picture overall. And if we fast forward to 2015, there was inadequate medical examiner office facilities. So if you take a look at the office in Missoula, it was the 2 forensic pathologists, but they had no autopsy assistants. There was no photographer. There wasn't anything other than the 2 forensic pathologists. And so, you know, of course, what do you do when you have a 2 or 3 or 400-pound decedent and you've got to roll the body to take a look at the back and take a picture at the same time? And so there are lots of different issues. There were limited resources. There were some challenges. In Eastern Montana, in Billings, we had a sort of an old basement morgue that existed in kind of the bowels of the hospital. It was less than optimal. It wasn't good.
I didn't
include
see
those
it.
pictures?
No.
Oh, okay.
I
That's
think
right.
I took them out.
It was.
Sorry.
It was.
They go along. There's a lot of pictures.
It was not a good situation. At any rate, you know, you've got 56 county coroners, and there's inconsistent paper reporting and in investigation in those counties. You've got some counties that are like 500 people total, their total population. So they may experience 5 deaths a year. You know, if you accept that 1% of the population will check out each year. And that, you know, of that, you know, maybe a third would require evaluation by the coroner or the medical examiner's office, and maybe a third of that would require a forensic investigation. So you're not going to get too much experience working in those kind of counties. And then since we've got a pathologist on the east side and we've got 2 pathologists on the west side, and I'll just quickly say that they didn't get along at all, there was no collaboration in terms of how work was done in the counties or throughout the state. And so in July of 2015, the medical examiner system failed. So two pathologists who were in Missoula, one resigned and went into sort of an early retirement, and the other went off to North Dakota, and he took a position with the University of North Dakota in terms of teaching medical students, but also doing forensic cases. The pathologist who was in Billings was forbidden from doing cases further in the state of Montana. So that left them with that situation where they're sending bodies all over the place. Locums pathologists ended up being brought up to the state, of which I was one. I had never been to Glacier National Park before, and I thought, you know, I'll go up and do some autopsies and see what the park looks like. And then I got hired. They asked if I would take one of their full-time jobs, which I didn't do until November. They had hired two other pathologists from Missoula. I went to Billings, and at that time, throughout the state, we did maybe a little over 500 autopsies per year. So the transformation efforts, about 9 months after I got there, I was asked to take over as chief medical examiner. They had experienced some additional problems. And the first part of the transformation efforts was to create a vision statement, which was that we would strive to create a partnership between the medical examiners and coroners to promote the health, well-being, and safety of the citizens of Montana through education, service, and compassionate professional death investigation. So formal coroner training increased from 56 hours a year to over 112 hours. Kayla's participation in that process, and you'll see a little bit later, has increased that even in more ways than we even imagined back then. We started off with 3 pathologists, 2 in Missoula, and myself in Billings, and then there was some visiting pathologists that would come to assist in Billings on occasion. We had 2 full-time autopsy assistants and 2 part-time. The concept of a coroner liaison was in 2016, because I was basically by myself in Billings. We're trying to work with the coroners and establish a good relationship. I needed somebody who had good investigation skills to assist the coroners and assist me as well. In many ways, a good example would be electronic medical record. How many people here have access to electronic medical record hospitals we work with? Higher hands, like you've just seen like 3 or 4. Yeah, it's an extraordinary resource. How many times have you tried to get medical information on somebody who's deceased? And you've got to call the doctor's office and they're not there, or they're on vacation, or we'll call you back, or I can't talk to you because it's HIPAA. And it's like, no, it's not HIPAA, they're dead. Oops, oh, thanks. One more?
Yeah.
Okay.
That's where you were.
That's where it is. All right.
Yeah.
So the concept of the coroner liaison, that was when it was established, but the state didn't have the budget for that funding. How many times have you guys had funding issues? Right. So it was the NIJ NCF grant. That was my goal, was to get the funding for Kayla's position. So that was sort of my buy-in in the process. Scott was the first one who was involved in that initially, but then he went on to New Zealand. At any rate, not too long after we got there, there was an opportunity for us to work with the Montana Department of Public Health and Human Services. You're all familiar with the National Violent Death Reporting System, or I imagine most of you are. The state of Montana was one of 7 states that was not a participant with that process. The Department of Public Health and Human Services was approached by the CDC, and they said, hey, there's a $2 million, I think it was $2 million, non-competitive grant. All you have to do is put together a program to get the information to us, and we'll fund you. And so that's what the folks at DPHHS said. I talked to Scott, and we're like, Scott, we've got this great opportunity to create. We can get rid of the paper reporting that exists from all the 56 county coroners we can put it into an electronic format that they'll have access to, that we'll have access to. It can be a repository for photos. And we were able to talk to the folks and say, give us an API, an application platform interface that would work with the vital statistics, so that once the coroner completes the information on the death investigation form, then it also populates the death certificate information. And that's how we started off during that process. And that was actually in 2018 that it was conceptualized. It didn't actually start until December of 2019, so not quite 2 years afterwards. But they're also asking for us. So at that time, we have an office of 4 pathologists, 2 full-time medical assistants, or autopsy assistants. That's our entire staff to implement this program. So we were kind of understaffed to do that, but anyway, we kind of got it started. Our facility upgrades were established fairly early on, and we were able to build a brand new building in 2019. January 2019 is when we occupied that space. And then the 4th full-time pathologist was hired by April of 2019. And then we were able to accomplish name accreditation for both the Missoula and the Billings office by June of 2021. And then Kayla's position was started in 2021 as part of the NCF grant. So if you take a look at medical examiner jurisdiction, if you take a look at every state's got different titles for how they list their laws. Montana happens to be Montana Code annotated. It's updated every 2 years when the legislators meet, so they don't meet on a yearly cycle. It's every 2 years, so things are a little slow and going along. You can see in terms of jurisdiction, when death occurs as a direct result or acts or events that occurred in another county, the county of the coroner, the coroner of the county where the acts or events causing the death occurred has jurisdiction. And then if a coroner that has jurisdiction fails to act, the state medical examiner has jurisdiction. So that's a little bit different. I think I skipped a slide. Oh, I guess I didn't. That might be next. Okay, so the coroner has jurisdiction to order an autopsy, but if the coroner fails to act, then the medical examiner has jurisdiction. We'll see if the other slide is there, but the state attorney general has the authority to order an autopsy, and the county attorney has the authority to order an autopsy if the coroner does not. So this slide, probably wondering why is this here? Let me see if this works. Okay, there we go. So I would say everybody's heard, if a tree falls in the forest and there's nobody there to hear it, doesn't make a sound. And the analogy to that would be if you're a medical examiner, or if you're a district attorney, or if you are an attorney general in the state and a death occurs and you have the ability to order if the coroner fails to act, you even know that a death has occurred if it's not been reported to you. So that's the importance of the online death investigation system. And it was called MT, so Montana Death Case Management System. So coupled with the Coroner Liaison, with the county's 56 county coroners and a medical examiner's office, we had the opportunity to create what was in essence a centralized medical examiner's office in coordination with a coroner system. So the most important part, was trying to do a handshake, to tell the coroners, we're not here to fight you. We're not here to demonize you. We're here to help you. We have to work with the coroners to do that. And so the coroner liaison, the liaison is a person who helps organizations or groups to work together and provide information. So in this particular case, we were looking for an experienced fellow of the American Board of Medical Legal Death Investigation to come and assist our work that we were doing, the coroners and the medical examiners. And we're also looking for somebody who had computer skills to help us with our process. And that's Kayla with Aaron and is it, I can't remember, Himalaya someplace?
Yes, in the Himalayas. It's near Everest Base Camp. In the Himalayas. in the top.
And I should have you put an information in here anytime you want to. They don't get bored of me.
Well, I have slides after this one.
Okay, so it's to provide educational opportunities to promote, that was actually part of that was from the work. If you
Yeah.
take a look at Montana population, looks like you updated the population, so you're a little over 1 million. And if we take a look at deaths in 2019, about 10,435 deaths, or approximately 28 deaths per day. That might be what Kayla might have handled in a day. In Denver. And then in terms of the actual coroner investigated deaths, approximately 7 to 14. Let's see, other stuff I think is covered. There we go. Okay, I'll shut up now.
So this is the introduction to the coroner liaison job I was given when I was still in Denver. What my boss, who was going to be my boss, knew, what our financial officer, who was a part of the grant, knew, and what Dr. Kurtzman had put together for me to try to accomplish once I got to Montana. So one of the nice things about going back to Montana is I grew up in Montana. I spent most of my life there to start with, which makes a huge difference when you're talking to the grumpy old men of Montana who are doing death investigations, right? So the whole goal is support the coroners, support the medical examiners, be a resource for death investigations. So I have to have as much general knowledge as I possibly can about what we do for death investigations. And I have to not know about most of the details of the case when I'm telling them what to do, because they don't like to give me information for some reason. So working towards statewide consistency in death investigations. So one of the pieces about Montana that's interesting is we range from our smallest county that gets 1 death every 3rd or 4th year to counties that get 6 or 7 a day, and that's considered a very busy day for them. So you have a large number of people involved in the process, but a very narrow field as far as how much they know about what they're doing. And then the increased usage of our death case management system, which we're going to talk about continually because it is absolutely important to what I do. But there were definitely some flaws with the system that came into being in Montana. So one of the key pieces of what my role is that I do not report to the state medical examiners. I don't report to our chief medical examiner. My boss is the administrator of the forensic science division, which means I spend a lot of time arguing with doctors, but all of our medical examiners have to trust that I know what I'm doing and that I'll stay in my lane. So when I have any one of our hundreds of coroners call me and ask for cause and manner of death, I get a doctor on the phone. And our doctors have to trust that I'm going to do that, because otherwise they get grumpy because I'm not a doctor. I don't do diagnosis.
And I just want to add to that, that was really important for us to create that process, because even though we had 4 forensic pathologists within the state, there wasn't always the uniformity that one might like. And I would have a lot of calls of like, Rob, hey, can you do this? Rob, can you do this? It's like, I can't do everything. And it was important for me to have the coroner liaison not report to me. I wanted the coroners to be able to respond to the forensic science division administrator, or directly to Kayla, so that they didn't feel as though they were stepping on my toes if they told me that they didn't like what one of my deputy medical examiners is doing. I wanted Kayla to be independent of my direct position.
So I work with the doctors. The running tagline for it is that I'm bilingual and that I speak doctor and cop. And I speak not fluent in doctor, but I can do it when I have to. I can keep up with these guys most of the time. So we had some initial steps for how we were going to try and process this job, right? It's a job that hasn't really been done before. There's not really people out there doing this job. And so when you're going out to create a position and you have to go through and figure out that process, how do you do it? So the first thing I did was get familiar with the legislation, the state laws. I had done that in preparation to go back. I knew some of it from living there for years. It was pretty easy. There's a lot of similarities between what I did in Colorado and the Montana legislation. Easy enough. Death case management, they had a system that was paid for. Public health brought it in. It was not a death case management system. It was an EMS fire system converted to work for death investigations. And it was not well functioning. The questions didn't really make sense in the order they were in. So I spent a lot of time not only learning how to use that system, but rewriting the forms. And more importantly, rewriting how the forms printed for the doctors, because the information the coroners were putting into the system for 2 years before I got there was not all printing when the doctor hit print. So then the doctors are mad they're not getting information that's obvious to them that the coroner had done. They put it in their report. It just didn't print. I was like, well, that's an easy solution. Here's more information. I'll just change the way this prints. Now you have it.
If they printed the report or even entered it in.
Also that, yeah, the doctors don't print reports and the coroners don't always enter they'll write a name and date of birth down, but they won't always do a lot more. So we did a coroner survey out of the Forensic Science Division in 2020 or 2021. So I took a lot of information out of that survey, reviewed the previous year medical examiner's report. What are they doing? What's our statistics look like? Then I started the goal to start meeting some of the coroners, right? If you're gonna work between people, you need to know who the strong players are. And you'll see that the sequence of office visits was important. And that's because there are some coroners that are very, very grumpy old men who were not happy that I was going to be around. And it wasn't just that it was me that was a young female coming in and I was going to tell them how to do their jobs. It's that any state representative wouldn't have been a great fit for that. So there's a little bit of conflict that will kind of unfold as we go through what we did. So the coroner survey results basically showed death case management system not working. They have limited communication with the guy running it. He's not answering the phone. He's not fixing things. There's a problem here. I met with him, found out a lot about why. We have a new person in that position now. It's going much better. They wanted more training in general, which is great for someone like me to come in. I'm supposed to optimize how we do this, get everybody on the same page. They want training. I can get training brought in. They wanted more training on how to use the death case management system. Also pretty easy to fix. As I started meeting people, I started teaching them how to use it better. I also made a lot of changes to the system. And then we have redundant systems. So I don't know how everybody else's state works, but in Montana, they have to write, if they are a sheriff, they have to write a CAD report for their police agency. They write a death report, and then they have to do the vital statistics report and violent death reporting. And it's all the same information 4 times. And they really don't like doing things 4 times. And I really don't like having them do things 4 times. So we started getting rid of that as quickly as possible.
And we attempted to get APIs, but of course, if you have an API behind Zerker and Image Trend and
It's
Health Department,
expensive.
it's thousands of dollars.
Thousands,
They don't have the
millions.
budgets.
They won't do it. We had one that was supposed to work. It didn't work. It still doesn't work. We're working on it. It's a continual battle. And then I go to look for contact information for the board from the Montana Coroners Association. And I find their last meeting minutes. And there's a note in there about how the legislation in 2021 passed House Bill 313, which is the bill that says, hey, by the way, coroners, you now have to use the death case management system by legislative action. You have no choice. And what do they think of that? The state slipped something through under the rug without them knowing. So I got to be the first person from the state to go out and be like, hi, I'm Kayla. I'm from the government. I'm here to help you all. And they were like, we're having nothing to do with that. Luckily, it went pretty well most of the time. So this is the process that I approached it with. Growing up in Montana, I know that in Montana, it is important to meet people face to face. They will call them on the phone. They don't care what your voice sounds like. They take in no information. And that was a great phone call, hang up, forget it ever happened, right? So our Department of Justice, we have a crime lab in Missoula. That's our primary lab. We have a crime lab in Billings. It's kind of like a satellite lab. We kind of get forgotten. I live out near Billings, so I know we get forgotten. We have 4 forensic pathologists. I know some of you are doctors and you work with doctors, and do you know how many doctors agree? Because I feel like it's none of you ever. You never have the same process, you never want the same information, and try getting 56 different counties to report the information that that doctor wants that that one doesn't. They get irritated and you have to learn to bring it all together. So that internal incongruency had to be addressed as quickly as possible. And so we do kind of have a better process now of at least the bare minimum required to send a case to the medical examiners. We're getting better as we go. This is what our coroner system looks like right now. As of the last election cycle, we have 41 sheriffs that are also coroners, and we have 15 civilian coroners in our state. This is a little bit better breakdown. We have three sheriff employed civilians. So we have 3 sheriffs that are the coroner that have hired civilian coroners. We have a sheriff's deputy who got elected as the civilian coroner. So when he's not doing his day job as a sheriff's deputy, he does coroner work. We have about 36 sheriffs who are coroners, and all of their deputies also do coroner work. We have a civilian funeral director who got smart and realized that the sheriff's deputies know how to investigate things, so he just pays them to do it. We have 6 or 7 civilian funeral directors and about 8 civilians who are coroners as their secondary jobs. We have no coroners in our state that coroner is their job. They do only that job to get paid because they don't get enough cases and make enough money that way.
Yeah, all right, so when you say there's sheriffs that are also the coroners, is the sheriff also elected position, or is it?
Yes,
They're
and they're
elected-
typically elected sheriff coroner. It's like
Oh, so in
part
that
of
county,
their
they're elected
job.
sheriff
They
coroner.
get paid to do both. The payment system on it is very bizarre. Had a lot of arguments with county commissioners over it. It's a great time.
Each county can decide if they want to appoint
Sheriff as the coroner.
Right,
And so they don't run, the sheriff doesn't run for coroner also.
they just run for sheriff. And
Yeah,
they appoint
and
the
they
coroner.
become the coroner, yeah. So this is a map of Montana. This is not even close to actual size. So what I did was start approaching the state and going and meeting with every coroner I could in an order I thought would make sense. Like the president of the Coroners Association, who was on my interview panel, I thought would be an easy person to meet with. After 2 weeks of him not taking my phone calls, I met with a coroner in Bozeman who happened to be a close personal friend, gave me his personal cell phone number, and I called on my drive from Bozeman up towards Helena and said, I'm 30 minutes from your office. I hope you're there because we're having a meeting because I need to know the landscape of what coroners are doing in Montana from someone who's not a medical examiner. And he met with me and it worked. And I found out that approach works really well. If you're driving through a town and you stop in to see the sheriff, they will actually meet with you. One of them did apologize because he didn't take my call 3 times in a row. So I put a hold on his toxicology and he didn't know. And then I showed up to the Sheriffs and Peace Officers Association. I'm like, oh yeah, you're the guy that can't call me back even after I call you 3 times. He came over, he handed me his cell phone and he said, put your number in there. I promise I will answer every time you call from now on. I'm really sorry. So some of the challenges I found after I met with all of our coroners, because I have now met almost every coroner. I've met every coroner in the state. I've met almost all of the people who are coroners in our state, which is a huge number. Some of the challenges is it just doesn't happen here mentality. Like if you're from the middle of nowhere, you just don't expect things to happen like they do on TV in your town. And I've had to challenge, like that's going to be the title of my memoir when I write the book on what I did, because I've heard that 8 or 9 times on cases where the coroner was like, I don't need an autopsy, bring it in and it's a homicide. I'm like, remember when you didn't need an autopsy because that just doesn't happen here? It definitely happens here. So we're learning that together. One of the big issues is the number of investigators. If you think about your office and the number of investigators that you have any amount of control over and can influence to do cases the way you want them to, what's the highest number you can think of? Anybody in the room, give me a number. 2, 20. Denver has 9 of us. We have 475 coroners in my system. We have some coroners that get 1 death every 3rd year. We have a large number of counties that get less than 5 cases a year. Over half of our jurisdictions get less than 10 cases a year, and they have multiple coroners, which means I know that I have investigators out there taking less than one case a year, which means I know that when they get a call, they don't know exactly what they're doing anymore, and they definitely don't have the right contact numbers anymore, right? All of the phone numbers have changed. Half of them can't remember my name and phone number. If that repeats year after year, you just crumble, right? Physical distance to crime labs. We have 2 crime labs in our state. It's huge. I put 8,000 miles on a car in 3 months because I was driving to meet all these guys. If I pull from our farthest away jurisdiction to get a body in for an autopsy, it's a 6-hour drive one way. And then they're there for the autopsy and they got to drive back. That means I'm pulling the coroner out of commission for 15 hours to come in and do an autopsy. So we have to make some choices about what type of cases we're doing, right? So we have to think about things in a different way. When I was in Denver, if I had a question at all, the body was coming with me. We were doing an autopsy. It took an hour. Not a big deal. If I have to pull someone out of commission for that long, I got to really evaluate, is it worth it to get that exam done, or can we do it a different way? And so we're training to get a little bit more leniency so we know the coroner has the knowledge base to make those decisions. And then I don't know if anybody else has heard that we have an increased caseload and no increase in budget in the coroner realm, medical examiner realm, anybody else. I don't know what yours looks like. I know in the state of Montana, over the 5-year average from the past year, our average increase in our state is up 41%. In one of my largest urban counties, they're up 75%, which means that over the course of the last 5 years, they got an average of 200 cases in a year. Last year, they did 350, and they don't have increased staffing, which means they're one of my counties that has to drive for autopsies. So they have that added to their budget. And so how do you accommodate that when you don't have a contact at the state level? And so until recently, how do you even know who to reach out to? And so that sheriff and I met and we pulled numbers together for his county and went to his county commissioners together. And we said, this might be a sheriff's budget, but we got to do something about it. You can't just let the body sit there. And so figuring that out and knowing who to go to and having the coroners have support for that at the state level. And then it's just hard to know what's unknown. They, like I said, sometimes we still have counties that think I'm not going to figure it out. They hired me. I said in my interview process, when they asked me if I could figure out the death case management system, I'm a millennial. I'll figure it out. I'll learn how to work your system and I'll make it work for me. And I do. I have Google alerts set that run for every single county in our state. I have them tagged on every social media platform I have. I usually know about the case before they report it to me. And I'm calling and asking them questions so that if I know they're out there, I know they're getting what we need. I know I'm not sending them back because they're not going back. They don't have time. So this job became resource management real fast. What do I know that they need that they don't know they need yet? So what I did, I started putting together spreadsheets. I have a list of contact information, every police agency, every EMS, every hospital, every assisted living, anywhere that I could find a name, phone number, and fax number, found it, put it in our system. They can pull it from anywhere. Medical records requests, pulled them, they're all automated now. Subpoenas, automated. They can print them for their county, they can sign them, they can take them wherever they need to take them. Anything I can do to expedite their process, I've done. And that's all just because I know they're going to need it. And when they need it, they're not going to have time to figure out how to do it. So what can we do to make their jobs easier?
And that's for the medical examiners as well.
Yes.
And so when I think of improving the way that medical examiners currently do their work, people who can function in Kayla's role are a physician extender. In many ways, just like a physician assistant or pathology assistant. So Kayla's efforts have been invaluable. So we have achieved in part.
So one of the biggest things this did is we have forensic science division. We have 8 different pieces of our office. It's one point of contact because you know these guys that take one case every 3rd year, they don't know that when they need fingerprints, they don't know who the current latent print analyst is. They don't need to because we're going to run their prints one way or another. Continuous case review, I'm up at 6 a.m. every morning. I read every case that's been put into our electronic database. If it needs a doctor to see it, I send it to the doctor that's on that day. If it needs more information, I call the coroner. I'm sure you saw this on scene. I know you did. I've been on these scenes. Put this in your report for me because it's the last piece of information we need to say that you did enough. And then we're done. We can kick it out. alleviate some of the questions to medical examiners. I'm not a doctor and I don't pretend to be one, even close. So they have an on-call number. They can call and get a doctor on the phone at any time. But there are questions they can call and ask me, and we can sort things out before we get to the doctor level. Or we can just work through some of the scene investigation pieces and make sure they have everything they need to have before they go to a doctor. Because they'll call and they'll say, well, I don't want to bother a doctor, but, and then I'll go bother a doctor for them, which is fine. Or I put them on hold, three-way call a doctor, explain the situation, we do it together. But it's one point of contact. It's one phone number they have to remember. They need one person that they can interface with. And it's much easier to be able to do that and learn about the other pieces than it is to try and remember which of the 20 phone numbers at the state lab you need to call to get the right person on the phone. So quick, easy access for medical records. It's also a lot easier to get licensing for one person in a medical record system than it is for 475. So I have access to almost every record system in our state. And if a different county needs one from somewhere else, I can just go in and pull it. And I give them the short version. They don't have to fax a request, wait 4 days, get 50 pages, hand it to a doctor because they're not going to read it. And even if they did, they wouldn't know what it was saying. So what's the point? So we try to make those processes a little faster and get them the pieces they need to do their work. I just left this slide in just when I asked the coroners what they thought was important about this job. You can't be shy and you can't sit and you can't wait to do things. You have to be proactive. So these were some of the things that they thought were important when I asked them. Yeah, so this is just a very basic overview of the death investigation process, right? So when you go to the scene, you have this big, massive piece. That's the cool part that everybody wants to do. When you leave the scene, there's a ton more information that you're going to want to get. My problem is I don't have a single person that's a full-time coroner. So when they leave that scene and they leave their office for the day and they put in their 1 hour on a case that needs 8 hours of dedicated time, we're not getting supplemental investigation. We're not getting interviews. We're not getting backwards into medical records. We're very quickly case triaging, deciding what kind of postmortem exam we need and determining a cause and manner of death. And so the supplemental investigation is where I can help. If they don't have time to do it, if they don't know how to do it, I can help them do it. I can do it for them. Usually we work through what do you have time to do? If they're a middle of the night person, they send me an email and ask me to do something during the day for them. I do it, I send it back to them. Because that way they get it done and they know it's done right, but they're not trying to ask somebody else who doesn't know what they're doing either. So anything that we can do to make life easier. And then your overarching kind of administrative death investigation things, mass fatality planning. I got a call from a coroner. She needed a mass fatality plan for her county. She had called 3 other counties and no one had one. And she said, what do I do? And I said, give me a week. We wrote a template for how to write a mass fatality plan for counties in Montana, because if 4 counties don't have one and I have 51, 52 other counties to go, they all need one. So we just wrote a template. It's easier. Now they have access to one. Cases where multiple counties are involved, they don't talk to each other well. They transfer jurisdictions and they give like 2 pieces of information, name, date of birth, that's it. And they're like, here, good luck with this. And then the doctor gets a report from neither county because both of them were like, it was his problem. Legal or high level investigations, anything with lawyers involved, generally I get a call because they're like, what else do I need to put in my report? Because they've never had to know before. Those delayed deaths where you have someone who gets shot and dies 20 years later, they've not had to deal with something like that ever before. And so that first time having someone to hold your hand and walk you through it, it helps a lot. And then communication, other state agencies, they call me if they need something from pretty much anywhere else in the state, because I have access to, you know, like the state phone tree system, and I can just pull a phone number out of my Rolodex and hand it to them versus calling around every phone number at state government, which exists in 8 different cities across the state, trying to find the right person. So some of the changes we decided to make after this whole process kind of came around. Our death case management system, we revised the reporting form, we revised how it prints. I added 270 questions and 18 different specific death reporting forms. So if they went out to a hanging, they'd never been on a hanging, they could pull up the form and they could ask the questions on the form. Make it simple. The doctors know what they need. Now the coroners know what the doctor needs to make a decision. I have a step-by-step guide. It's now online and available to you. So we wrote all of that into it. I put over 40 change requests into this company in the first 3 weeks that I was employed in the state of Montana. What we learned from that is 2 years later, we are preparing to get a new system because that case management system went, we can't do death investigations. We're in the EMS system. Sorry, we're going to back out. Luckily, we already had an RFI out and we were looking for a system. The nice thing about this new system is it is going to do everything that the first system promised. And we already have that buy-in. Health and Human Services is going to pay for the second system. They're going to continue funding it. And everything that's being done in that system is known that it's needed. And we're in that process of getting something new.
And the counties wanted to be assured from the very beginning that they're not gonna have to pay for it.
Right.
So that was a key aspect.
So some of the training we changed. So I don't know what your training is like in your states. I don't know what's required. In Montana, the requirement to be a coroner is 40 hours of coroner basic training that I'm a part of. I don't teach the whole thing. The current president of the Coroners Association does, and he does a fantastic job. But you don't actually have to have been through the coroner basic training. You have to plan on going to the training when you start taking cases. So you have to want to go in the future at some point. And if you miss one, you kind of get faulted on it, but you can still take cases because no one checks on you. So in our state, you have to really want to do death investigations, and then you can't, as long as someone deputizes you and says, yeah, go ahead. So we're working on that. There's not really a previous experience requirement. We have sheriffs that get elected, they become coroner, they have no experience. Continuing education, 16 hours every 2 years. It's one course every 2 years. It's very low. They get almost no case exposure. So what are we doing about that? My first coroner basic was in December 2021. I was asked to stay on and continue helping teach it. By last December, I was asked to host the trainings for both our basic and advanced coroner through post for our law enforcement academy. And now I am the one that picks what trainings we get into our state and brings in training. So that helps a lot. It also helps with continuity. I know that what we're bringing in as far as training is not going to change while I'm still here. So some of our resources that our coroners have available to them, most of them don't know about a lot of these. And if they've had a case that needs it, they know about it. If they've never had a case where it's needed, they don't even know it exists. So there's a lot of things we're doing that just exist in the background. It's going to be there until they need it one day, and then we're going to make sure that they get it when they need it. So we do a lot of things just to help let them know we can. I left this slide in here because this was a very grumpy coroner who is also a sheriff. The first time I met with him, I called him a grumpy old man to his face, and his undersheriff about fell out of the chair laughing at me. And he came up to me at the last Coroners Association conference and he said, you know, I really didn't think I was going to like you, but you sure answer the phone when we call, and you're always helping us even when we don't know it. So I took that to heart. We still laugh about it. He still calls me whenever he needs anything, and I definitely answer whenever he calls. But some of the system improvements we've seen, our toxicology turnaround time, toxicology is magic to these guys. They have no idea what happens, but they know if you submit toxicology, it comes back and solves your case. So the problem with that is they submitted toxicology on every case, regardless of what it was. 95-year-old hospice patient requests toxicology, and it's like, no. So our head of toxicology and I started triaging cases, and we would just reach out to the coroner and go, hey, toxicology isn't going to solve this case. Can I put it on hold? We'll hold it for a year. Something comes up, let us know, we'll hold it. We turned the toxicology turnaround time. It was about anywhere from 12 weeks about when I started-ish, 12 to 16 weeks turnaround. When I looked last week, our average turnaround time for a coroner investigation was 6 weeks. It makes a huge difference when you're not requesting unnecessary testing and putting a burden on your lab. So it's huge. Fingerprints on every medical examiner case. I had to fight for that, believe it or not. we like our identification to be like, well, it looks like his driver's license. Okay, good enough. Here we go. Our folks at our Division of Criminal Investigations for the state approached me shortly after I started and said, we will do the casework if you get us fingerprints on everyone that dies in the state. We'll run them through NCIC. And I said, there's no way we're getting them on everyone who dies in the state, because I would have to drive to all 56 counties and teach how to do fingerprinting, and it would be a mess, but I can convince the medical examiners, which was a bit of a stretch, because then I had Dr. Kurtzman was still there. He supported it, but our current chief didn't really like that idea, because it's time that the doctors and autopsy assistants had to commit to doing the fingerprints at the autopsy that they didn't necessarily have. And we had to get our boss involved, and he had to mediate us fighting out whether or not we would fingerprint every dead person that came and got an autopsy from our office. I won, we do, we get 55% of them identified by fingerprints out of the criminal system alone. So if we were submitting them for the civilian databases, I know we would get more, but that's a battle that we have to kind of continue to fight. And we are now pushing it out to county coroners. They know they can do fingerprints. We're starting to work with them and train them to do that, maybe instead of driver's license. Good enough.
We have 2 minutes.
Those are the other things. We've built relationships with all of our law enforcement partners at this point. I can contact every coroner in the state with just a phone call. Out of our 56 counties, 53 of them are using our death case management system. When I started, it was 37. So we are getting an improvement there. The ones who are not, by the way, are the very small counties that don't have a lot of cases. So I can't really say they're not. They just might not have had a death yet to report. Also, some of them still use flip phones, and one of them still pencil hand writes his reports. So I don't expect him to switch to a computer overnight. But we have someone for them to call, and it's just a different system, right? When you live and work in your county, sometimes you don't have the authority to call your neighbor who happens to be the doctor you're fighting with that week. And so sometimes it's just having that extra person on your side. And so what I tell them is, I'm the person who is on their side. And so if they have a battle to fight, if they have a case, if they have a question, they can call me, and I'm not going to judge them. I'm not going to tell them they did something wrong. I'm going to support them, and they get to make the decision of what they're going to do. I'm just going to give them all of the knowledge base that they need to make the decision. We have like 1 minute for questions. That's as fast as I can.
Yeah, just real quick, how many cases are coming in for autopsy?
Right now we're probably going to hit 600 this year.
Should actually more, because we're at 800. Because you're right now, we're over close to 500.
Yeah, we're way over that.
Probably between 800 and 900, I would guess.
Is that a mixture between schools or limited?
So it's
Yeah.
a mixture of external examinations, some partial autopsies, and some mostly complete autopsies. When I first got to Montana, we were just under 600 cases per year.
Oh, that's right.
And then we increased the number of cases when I departed last year. I think we were 850.
Yes, and it's scheduled to be highest numbers ever. Our doctors are really taxed at the moment.
Is that for the 2 offices?
For both offices, yeah, combined.
And one of the goals that I had was to establish the office as a regional autopsy service. So we incorporated hospital autopsies because they didn't have the resources for hospital autopsies. And then we started to bring in cases from northern Wyoming because it was our neighbor, it was close proximity.
Yeah.
What was the reason for the medical request instead of the subpoena?
So part of that is because when you send a subpoena to a hospital, a lawyer has to look at it. When you send a records request from a medical examiner or coroner, our state has a law and HIPAA has an exemption for coroners and medical examiners. So it goes straight to release of information. They send it straight back. It's a faster process. If they don't need a subpoena, don't subpoena it. If they're law enforcement, they have to get a subpoena. If they're working strictly as a coroner, they can have it. So we just changed their process. They thought they needed subpoenas. We taught them they didn't.
This may be an administrative question, but maybe a question for Doc. So this sounds like a really specialty position. There's not a lot of them out there, as what you described, right? Not
Right.
a whole lot of liaisons. How did you recruit and structure the salary for this institute?
So when I got there in 2016, I was working in the hospital dungeon ward. We had a cooler for 2 bodies. And we were handling all the cases. I had no backup. I had one autopsy assistant who had no backup. And then 9 months later, I found myself in the position of chief to try to administrate the office. And so I was pleading with our administrator, you know, I need somebody who can assist me in the work that I need to do to work with the coroners to help them. And so I said to Scott at the time, I would like a position, we're gonna call it the Coroner Liaison. And there was no funding for it. And so fast forward to the inception of the first grant, NIJ-NCF grant. And Scott knew some of the people who were working with the NIJ-NCF. But Montana also fulfilled some of the criteria because it required a rural medical examiner's office in connection with a forensic laboratory. And so that was, we were one of two in the United States at that point. So for me, you know, knowing where the office had been, just a few years earlier, it was like amazing. They want us to be part of the NIJ-NCF grant. And that's what funded Kayla's position. And then in terms of how we established the criteria, we wanted somebody who could function independently, who was very knowledgeable about death investigations. We wanted somebody who had come from a busy medical examiner's office, who knew how medical examiners think, who knew what needed to be done with death investigations, who could really act as a resource to support the coroners in so many ways that Kayla has just done an extraordinary job. And so Kayla was hired in 2021. It would have been nice if she had been there from the inception, when we started to make the changes in the office.
Thank you so